Hello, good day, everybody. You're welcome once more to my health corner where I give us health tips, health talk, and also give us information about health. So, today I'll be giving us a health talk on the topic PID. So, let's get into it. What's PID? It's an abbreviation for pelvic inflammatory disease. So what's the pelvic inflammatory disease all about? It is an infection of the female reproductive organs. This infection comes by spreading through the vagina into the uterus, that is the womb, and spreads to the fallopian tubes, to the ovaries, and to the cervix. So in general, pelvic inflammatory disease is an infection of the female reproductive organs, that is the entire female reproductive organs, because in one way or the other they are interlinked to each other. So once one of the organs gets infected, the other ones too are also infected. So let's know the risk factors of pelvic inflammatory disease. That is what prones an individual to getting this infection or getting this disease. One is having sexual intercourse before the age of 25. This is because the pelvic organs of the woman are not so mature enough, and also they do not have the normal bacteria that should be there, or the normal floras that should be there to prevent infection or to fight this infection. So once a woman starts having sexual intercourse early enough, it makes her prone to having pelvic inflammatory disease. The next one is having multiple sex partners. That is not being consistent with your sexual partner. It could make you prone to having pelvic inflammatory disease. Another one is having an unprotected sexual intercourse, that is having sex without condom. The next is douching. That is a means where women use in tightening their vagina, sometimes having a hot seat and all of that. The last risk factor is having an intrauterine device inserted, and also having a history of a PID. Most women have pelvic inflammatory disease recurring even after they have treated it, and this makes them so prone to having subsequent pelvic inflammatory disease. Let's get into the signs and symptoms of pelvic inflammatory disease. Number one, the most common symptom is pain. This pain could be at the lower back, it could be at the lower abdomen, it could be at the upper abdomen. Also have fatigue, have vomiting, we have nausea, we have fever, which is very common in infectious diseases. Also have headaches, we have chills, we have irregular menstruation, we have foul smelling menstrual bleeding, foul smelling vaginal discharge. We also have pains during menstruation, pains during sex, and pains during urination. So all these are signs and symptoms of pelvic inflammatory disease. Let's know how this pelvic inflammatory disease could be diagnosed. It could be diagnosed through an examination by a doctor, through a cervical culture, and through a urine culture and tests. So these are the few ways that pelvic inflammatory disease could be diagnosed. Okay, let's get into the prevention of pelvic inflammatory disease. Number one is have one sexual partner. Do not have multiple sexual partners. Number two is get protected. Make sure you use condom while on intercourse, sexual intercourse. Number three is get tested for sexually transmitted disease, because this infection is caused by the bacteria that causes other sexually transmitted infections like gonorrhea and other STIs, and the most common bacteria that causes this is chlamydia. So you have to be on a regular test. Once you have these symptoms, you go and get tested in order to avoid or have an early diagnosis of the disease. Another one is avoid douching. Please do not patronize such things. It's not good. And also have a good hygiene. a very good hygiene. Try not to use soap when washing your private parts, when washing your pubic area. Use just water. So let's get into the last but not the least part of it, the complications of pelvic inflammatory disease. We have three major complications. Number one is infertility. This is caused by extreme damage to the fallopian tubes and to the ovaries and the cervix and the uterus itself. It could lead to a complete infertility. Number two is ectopic pregnancy. Once the tubes are blocked, you could have an ectopic pregnancy. And the third one is chronic pain. So how is pelvic inflammatory disease treated? Once it is diagnosed, antibiotics, pain reliefs are prescribed only by a physician. They are not over-the-counter drugs. It has to be diagnosed, properly diagnosed, and the right drugs to treat it are prescribed, and you can take them. So in general, pelvic inflammatory disease is something that affects about 100,000 women in a year in Nigeria. It calls for a great attention because of its complications, which comes as infertility and ectopic pregnancy. Most women do not know that this is what causes it. So do not overlook pelvic inflammatory disease. Once you have these pains on your lower abdomen or upper abdomen or your lower back, or you have irregular bleedings and menstruation, you have pains during sex, pains during menstruation, pains during urination, you should seek the attention of a physician. Please, health is wealth. Let's stay healthy and live healthy. Thank you.